Now that we know what exactly PCOD is, let's go ahead and see what exactly are the causes of polycystic ovarian disease. Okay, now the first cause of PCOD is related to increased amounts of insulin in the body. Now, as you must be aware, insulin is required for the metabolism of sugars in the body. Now, sugar is the major source of energy for the body, and to break that sugar down into energy, insulin is required. So what happens sometimes is that the cells of the body get resistant to this insulin. So the sugar that is there in the body keeps on increasing as there is no metabolism taking place by insulin, and this happens in the pancreas. Okay, now since there is no metabolism taking place, the pancreas will automatically increase more insulin to combat the increase in sugar. So this increased levels of insulin is one of the cause of PCOD. The second cause of PCOD is genetic or hereditary in origin. That is, it is usually seen that a female suffering from PCOD usually has a family history of either her mom, her grandmom, or any other female in her family having suffered from the same disease. Increased amount of androgens is also a cause of PCOD. Now, androgens are nothing but male hormones. Now, when male hormone is secreted in increased quantity in the body, it will cause a hormonal imbalance which will show up in the form of male features in the female's body like hirsutism, that is abnormal facial hair, or again increased androgen is linked with increase in insulin. Another cause for PCOD is linked with hormonal imbalances, that is there is increased amount of luteinizing hormone or prolactin in the female's body. Now, luteinizing hormone or LH and prolactin are both hormones secreted by the female's body. The normal secretion of these hormones is very essential for the proper functioning of the female's body. But an increase in these hormones can be a cause for PCOD. And a stressful lifestyle or increased amount of stress and tension for a female has been seen to cause an increase in the LH or the prolactin hormone in that female's body. So these were the causes of PCOD. Just to summarize them: increased amount of insulin, increased amount of androgen or the male hormone, a family history or genetic causes, and last, increase or imbalance in female hormones, prolactin and luteinizing hormone. Now we are going to talk about the most important part of PCOD, that is the symptoms. Why am I saying it is important is because if you as a female can identify these symptoms in your own body, then maybe this could be a step in diagnosing this disease in yourself. Okay, now I've done a small caricature for you to remember all the symptoms in one go. Of course, this is an exaggerated image, but it does help to remember. Now let's go through all the symptoms from head to toe. Now starting from the head, there is a lot of hair loss. Now you will see in certain females there is a lot of hair fall that is there. There will be thinning of hair. Okay, the female will find clusters of hair on her brush, in the bathroom, on the floor. This is one major symptom of PCOD. In medical terms, we call this alopecia. That's with the hair. Now going to the mind. See, now as you know, there is a hormonal imbalance. So what happens is there is a lot of depression in the female. She gets irritated very soon. Okay, she doesn't really feel good about herself. After that, we go to the mouth. Over here, there could be certain eating disorders like anorexia, which is the female feels that she is very fat and she goes on extreme diets, like she literally starves herself just so that she can overcome this feeling of fatness. Or it could be bulimia, where the female will binge it, that is, she'll keep on eating what she wants, and then out of disgust for her body, she will go to the bathroom and try to vomit or throw up whatever she has eaten. Then going to the face, there will be a lot of acne, there will be a lot of pimples, breakouts. One very important symptom of PCOD is hirsutism. Now hirsutism is nothing but abnormal facial hair on the female. So the female will be growing a little bit of beard and maybe some little bit of mustache too. Going further down, okay, on the neck sometimes you see a black line or darkening of the skin in the form of a band. This is associated with the increased androgen or male hormone in the body. Insulin resistance is also there, and this too is associated with the same increase in androgens. Okay, coming down to the heart, there will be a lot of heart issues, there will be a lot of palpitation and anxiety that is felt by these females. There is also a high risk of type 2 diabetes. Going lower down, going to the abdominal area, there is obesity that is present in these females. That is, the female tend to gain weight very fast. Now this is actually a vicious cycle because PCOD actually causes weight gain, and weight gain in turn increases the symptoms and complications of PCOD. Okay, going down to the pelvic area, there will be a lot of irregularities in the periods, or maybe there will even be no periods sometimes, or the periods may come after 2 months or after 3 months or sometimes even after 6 months. Going to the uterus, there will be a lot of fertility issues. It will be very difficult for the female to conceive a child, and even after she conceives, there could be miscarriages. Overall, there is a lot of sexual dysfunction that is seen in these females because basically the female doesn't really feel good about her body, and there's a lot of lethargy and fatigue that is present in these females. So with this, we complete the symptoms of PCOD right from head to toe. I have tried to put up all the symptoms in this caricature that I made. Feel free to take a screenshot of it and use it for your further references.